This is an APAC Med webinar. I am waiting until people just join. I can see the numbers going up. You have a poll in progress just to try to sense your mood after 6 months of webinars. Please let us know how you feel. Opinionated, obviously, beautifully presented, warm. That's good for our panelists to know. So all of the participants that are joining, thank you this morning. We're very happy that we can have this, theme addressed around communication during COVID-19. APAC Med is a trade association representing the medical device industry. We have done a lot of work in the last 6 months to build this community and to build the ecosystem to support the patients and the healthcare professionals who deserve the best. I think one of the questions we have in the medical device industry is how to use the communication the best. So this is how I'm going to leave it to Priyanka now. We have obviously about 50 participants already today, so I'll let you do the introduction. I'm very happy with the panel, and as you can see, the majority are women, so it's always a great pleasure for myself. So this poll was just to break the ice and to let Priyanka some time to give the, so now you see, you have a lot of Jack Russells and German Shepherds, so it's going to be quite an interesting conversation I think you'll have. Thank you so much everyone to have joined this poll. Priyanka, up for you.
Thanks, Marilyn. Good morning to all the attendees. A very warm welcome to today's webinar. My name is Priyanka Bajpayee, and I'm the regional head at SPAG. SPAG is a specialized independent communications and PR firm with a very clear focus on health. We have won accolades for our constant work towards public health, the latest being the APAC Healthcare Agency of the Year 2019. At SPAG, we truly believe that all stakeholders need to collaborate and come together in order to synergistically move together and upgrade the overall regional health and startup ecosystem. It is undeniable that COVID-19 has caused a huge impact on businesses, devastating the sales, disrupting supply chains, and putting regular business practices on hold. There's so much of uncertainty in the business climate that business leaders and entrepreneurs may find difficulty to resolve. Today's webinar will explore how communications can help with addressing some of the pressing problems that medtech businesses face. I'm delighted to present today's experts who will discuss the current economic outlook, the economic impacts, and how medtech businesses can emerge from the pandemic. Today, we have Mervyn Teo, who is the Vice President of Quadria Capital, Asia's leading healthcare PE fund. Amit Whittle, who is co-founder Docquity. Docquity is a professional learning network for doctors. We have Melissa Teo, the Chief Marketing Officer and General Manager of MyDoc, which is the first digital health provider to provide holistic health management in the region. We also have Irene Lai, CEO at HealthBeats. HealthBeats is a global remote vitals monitoring platform. And Prabir Das, the Executive Officer of Terumo Corporation in Japan, which is one of the largest medtech companies globally. Prabir is also the regional representative for Terumo's business in APAC in India, and also Chairman and Managing Director of Terumo Asia Holding. Thanks a lot, everyone, for joining us in this fascinating and most relevant discussion today. Over the course of the discussion, Mervyn will talk about the economic impact that businesses in the region have faced, how funding decisions have changed the Quadria Capital, and what medtech startups can do to stand out from the competition. Amit will discuss how the pandemic has affected the healthcare industry. Melissa can talk about how COVID-19 has changed MyDoc's operations, and Irene will let us know how COVID-19 has impacted startup HealthBeats platform. Last but surely not the least, Prabir will provide his insights on how Terumo's operations have been affected in APAC. We'll have about 40 minutes for panel discussion, followed by 15 minutes for Q&A. For folks on the call, please go ahead and enter your questions in the chat box or the Q&A feature. We'll do our best to answer all your relevant questions. With that, let's go ahead and get started. Presently, there are at least 13.3 million cases worldwide with over 578,000 deaths. Specifically in Southeast Asia, we have around over 180,000 cases. As of 13th July 2020, only 12 countries in the world have not reported any COVID-19 cases. The World Economic Forum has predicted that the recession from this virus will be long-term and have far-reaching impacts from sustainability setbacks to technology dependence. From a business perspective, what would all this mean? Let's hear from Mervyn. Mervyn, perhaps if you would like to share about the economic impacts on the medtech sector. What are the predictions and growth for the medtech economy in APAC?
Sure. No, thanks, Priyanka, for the introduction and for inviting me to the session today. So like you mentioned, I mean, at Quadra Capital, we are a healthcare-focused private equity fund. We've been operating for the last 15 years or so. Today, we manage slightly over $2 billion of capital across our Asia healthcare portfolio. So I think specifically in terms of COVID-19 and its impact on us and how we see it impacting the Asian healthcare markets, I think as dramatic as we have seen COVID-19 and its impact and ramifications are, we do firmly believe that the global economy will recover steadily as we witness central banks around the world acting swiftly to elevate credit markets, while governments, I guess, around the world as well are actively enacting fiscal stimulus. For example, Singapore, we spend $100 billion to ensure the economy stays propped up. So I think governments are doing what they can to make sure the impact of COVID-19 is not as severe. And we do believe that over time, we will come out of this stronger. But I think more importantly, with regards to healthcare in Asia, COVID-19 has also served to remind us the intricate relationship between healthcare and economic growth. And this, we believe, will further elevate healthcare to actually the core of public and private sector agenda in the years to come. Asian healthcare has always been a big thing for both the public and private sector, and we think COVID-19 is just further impetus to bring that to the central discussion, whether it's in the public or private sector. Specifically, I think we see COVID-19 having certain long-term effects, certain long-term health effects actually, that include number one, I think infected patients will require ongoing rehabilitation, monitoring, and broader management. Two, we foresee mental health issues arising from the economic and social effects from the pandemic. And three, I think more importantly, we do expect an amplified healthcare burden resulting from delayed or missed treatments and diagnosis as countries go into lockdown and patients are not able to actually get their treatments and diagnosis. And we think that will actually have a more severe impact towards healthcare and provision in the years to come. I mean, as a firm, we monitor these trends closely and its impact on our portfolio companies, many of which are hospitals, pharmaceutical businesses, and medical technology companies in Asia, while really staying focused on our core strategy, which is to build market-leading scalable businesses that are capable of delivering high-quality healthcare at an affordable price. So I think overall, compared to other sectors like retail and tourism that's been badly hit, I think there is a glimmer of hope for healthcare, and I think that would actually well position the sector going forward as economies recover.
Great. Thank you so much, Mervyn, for the insight. I think very well and valid point made out there. And I mean, it's been time that public health is now coming to the center of the conversations now, which is great. And I believe you'll agree that Asia Pacific companies were the first to experience the full business impact of COVID-19 crisis, which has given a little edge in allowing companies in the region to be further along in terms of proactive responses and planning. Okay, so now let me ask you, Amit, as we are very well aware for the healthcare sector, COVID-19 has strained resources of healthcare providers globally. The number of elective surgeries has decreased, and other services, including dental, mental health, and allied health services, have stopped work to prioritize COVID-19 cases. The focus on finding a cure and vaccine has disrupted the global supply chains as well. The only boon, it seems, is that the viral pandemic has showcased the health industry's value, what Mervyn was saying earlier. Amit, I understand Docquity's work revolves around networks between doctors and various medical associations. Could you share about the recent trends you've noticed doctors discuss in relation to the medtech sector?
Yeah, sure. Thanks, Priyanka, for making me part of this panel. Just to give a brief background about Docquity, which Priyanka has already given. So we are a closed learning network of doctors with operations in Southeast Asia, and we have got around 200,000 doctors using our network. With the COVID, ironically, COVID has acted as a chief digital transformation officer, in the industry. What we've seen is there's been a quantum jump in terms of level of engagement among doctors, both in terms of scale and scope. So I'll talk about the scale, So for example, doctors are building connections among themselves. So in February, we were doing 2,000 connections a week. It has jumped to 6 times to around 12 to 14,000 connections happening over a week. Now, once the connections are formed, doctors are seeding discussion groups among themselves, of course, discussing about professional interests, Corona, of course, being one hot topic. And so we got around 20,000 user groups. And there'll be 3 trends which we have been noticing and tracking, in terms of discussion among doctors. One has been a lot on digital learning and digital education for doctors, digital training, digital education. Second, of course, because of limited patient access, patients cannot go to hospital, telemedicine has been a major discussion. And thirdly, because we have certain senior doctors and we work with medical associations, the online conventions is becoming a big trend right now. The physical conventions going off and doctors, coming online at a much bigger scale and doing all these discussions online. But so this is on the professional side. What we've also realized, over a period of time, doctors are more open to, in terms of community sharing about their personal habits and hobbies. So we started doing a lifestyle sessions, because, doctors are stressed. So we started doing yoga sessions, and we are seeing anywhere 1,000 to 1,500 doctors attending these sessions. So what we've realized, with this pandemic, doctor community has embraced digital. Definitely, and it's here to stay as part of their life. And the discussions are currently centering around Corona, telemedicine, what's going to happen in the medtech sector to make basically better patient diagnosis, as Marvin pointed out, for better patient outcomes. So I think that's where we are, and it's here to stay. Thank you.
Right. Thank you, Amit. I believe that the prevalence of the pandemic has changed the value that healthcare providers and workers have in society and the importance of their needs for almost every human being. Now let's discuss how COVID-19 has changed the way medtech businesses operate. Melissa, as a telemedicine app, how has MyDoc's operations been affected as a result of COVID-19?
Maybe let's share a little bit of context before I share about our operations. I think based on the Bain report that we contributed to, they've seen a 50% increase in terms of people who are saying that they are very willing to use digital health tools in the next 5 years, right? And if they assume that they are able to use something that's covered within their corporate insurance plan through the employer or through their own insurance plan, then the number actually goes up to 91%. 91% of the users actually say we will use digital health if it's part of the plan. And so, I think it's common knowledge. Telemedicine has become a significant play in the industry. It's taken us 8 years to get to where we are. We often joke that, COVID-19 actually helped us create what we created in 8 years, but did it in 2 weeks. So it's exploded. We have been receiving lots of interest from all around the world. Initially, MyDoc didn't really have an active intention to go into other continents, but because of COVID-19, we have actually entered multiple markets outside of Asia. So in that way, it's been good for business. Our daily active users have also spiked. We've seen 160% increase since the beginning of the year. So operationally, we've always been prepared for that because we always understood the real value of technology is to be able to scale healthcare effectively in a standard, safe way very quickly. So in that way, it's been positive for us.
Thanks, Melissa. And I cannot emphasize enough, and I completely agree that while the adoption of telemedicine has increased in recent years, it was not yet fully adopted by all healthcare payers, providers, and patients until COVID-19 happened. In response to the coronavirus outbreak, in fact, various governments have urged healthcare providers to communicate with patients virtually whenever possible. In fact, to help this aid, I also recently read that several federal health agencies have taken steps to help facilitate telemedicine adoption, which is wonderful.
Yeah, Singapore MOH has been very active. I mean, we've read the news about the issues with the foreign worker dormitories. I mean, with telemedicine, they were able to respond to that effectively and very quickly, right? So the initiative is still ongoing. Numbers are coming down, but MOH has been taking quite a careful, measured way of handling the situation. So they're continuing to manage it and sponsor it using our facilities to provide the services to the foreign workers. So the foreign workers don't have to worry about not being able to afford to see a doctor when they know they're not feeling well. So that it's been, I mean, the value of it has been just outstanding. And the way the Ministry of Health has adopted it, that has been nothing short of impressive.
Great, thanks. Eileen, as I always say, running a company is tough, and running a startup in a crisis, it's like triple tough. I'd like to hear from you, Eileen, as a remote vitals monitoring platform, how has COVID-19 impacted health peaks? Any challenges that you faced, and what was your coping mechanism?
Hi, morning everyone. Thank you, Priyanka. So I'm Eileen. Just a quick one, introduction about HealthBit. So we provide a remote patient monitor platform. While some sits in Singapore, a lot of our business is actually based out of Australia and as well as in the United States. So, so to answer the question in how COVID has changed us, definitely tremendously. HealthBit first started out because we have the perspective that we want to focus on chronic disease. And what we do is we put medical grade devices on the hands of patients at home for them to monitor their health and have the data transmitted real time to their care providers for proactive care management. So in that sense is that because we all know remote monitoring is well proven to help to reduce overall healthcare costs. So we work with the in Australia, the MPHN, which is a federal government agency, to roll out remote monitoring for their people, right? So when COVID happened, we are actually in the midst of rollout. So we were actually rolling out to multiple hospitals and primary care clinics in order as part of the program. And naturally with COVID, everything came to a standstill. You know, it came to a halt for a couple of weeks as people try to reconcile and try to look at what is next and what to do. So it was a difficult situation, difficult period for a startup, given number one, is that other than our current projects, whilst it's on hold, we know that it will continue eventually because of COVID situation. Remote monitoring became a lot more critical at this juncture as we move forward. The other part, and the other part is actually, the interesting part is we said, okay, we are set up, we don't have a lot of resource, we don't have tons of people or resources, but what we have is just a platform, literally, the technology. So we actually, for this crisis, we actually tweak our platform to cover COVID patients as well. So, and because of the existing market we operate in, probably everyone knows the number of COVID patients is really skyrocket high. So we have situation, for example, in US, where patients walk up to the hospital and they don't have a bed, right? We all know. So what we do is we work with hospitals and research centers. We actually provide patients that are that comes to the hospital and they have about on an average of 500 to 1,000 patients on a daily basis that was turned away. So we give them kits to measure their oxygen saturation level. This is to help them to monitor their health condition at home and to detect any deterioration. So we also start to extend into those existing acute or chronic patients that have no access to healthcare for whatever reason, whether it's bed or have deferred appointment or canceled procedures. So we start to as well give them kits to be monitored at home. We start to also extend because when the research arm of the hospital start to look into potential cure and as well as most probably a vaccine, and into rapid fast deployment into clinical trials, trying to look at COVID patients and see how they are reacting to certain the trials that they're conducting. We also extend our platform to allow them to collect information rapidly as part of their research effort. So on one hand, our existing project seems to have ceased temporarily, but it opens up another huge broad category of opportunities for us. So right now, of course, our project has continued. I mean, it has been a couple of months now. So in that sense is that the whole COVID situation actually, other than open up a lot more opportunity for us, we are also very glad that we can really make a difference in this space, in this situation. Thank you.
Great. Thanks, Eileen. It's so, I mean, it's such a great pleasure to hear your experiences and how you're coping up with the current challenges this COVID-19 has created, and fabulous work done out there. Prabir, as the lead of Terumo's functions in APAC, how challenging it has been for you? We've been talking about work from home setup, me and you, and recently Mr. Sundar Pichai talked about the same as well. And the shift that we all had to do with this COVID-19 situation, both mentally as well as operationally. How has COVID-19 changed Terumo's operations as PU? Prabir, you're on mute.
I said thank you. Firstly, to get me on this panel. Let me step back a little bit because so far whatever we have discussed predominantly. My colleagues on the panel, they are predominantly in the space of services, right? Because Medtech is not necessarily only about services. There are very brick and mortar companies like us who are in products, right? Or we are in services as well, but predominantly in products. So if you look at Terumo, it's what, 100-year-old company, 160 countries, massive operations, and we essentially build products and take it to the bedside or wherever they are going to be used. Now, if you look at our portfolio, we have three kind of domains. We are in the cardiac and vascular business. We are in the blood and cell technologies domain. And we are also in what we call general hospital products domain. Right. So if you look at the impact on us from a business standpoint, of course, there's been impact. It may have been a little less than many of our peer companies because we are so uniquely diversified. We have this very, a syringes, needle type product in our portfolio. And then on the other side, we have sophisticated, very high risk cardiac implantables and life sciences products. So I would say that the cardiac and vascular business remains largely impacted because elective cases are just missing, and not just elective cases. I mean, this is something that I wanted to talk about. There have been very strange phenomena, right? So if you look at acute heart attack, in medical terms, we call it STEMI, ST elevated myocardial infarction. The kind of attacks that you have in the middle of the night, you rush to the hospital. Globally, STEMIs are down 40%, right? It's very unique. I mean, what is not creating an acute heart attack? And this is not in a low healthcare penetration country like in India or Bangladesh. We are talking about United States, Australia, Europe, where you could 911. So our cardiac and vascular business is impacted. Of course, we have opportunity to serve patients because we have acute care there. We have something like an ECMO, which is used to support a very critically ill patient, keep almost life support. So that's showing high demand. In our general hospital product business, Demand has been hit. But there has been some stockpiling by governments, or BCP buying by large healthcare providers. So we see some sort of evening out. And our blood management business, if you look at it, there's virtually no blood collection, very, very little blood collection today, which is not good. It's a risk. If there was some sort of a large demand for blood, there could be anything, just because there is one calamity does not mean there would not be another. So we see that, but there we are seeing some increase in the realization that convalescence plasma can be, and we have a convalescence plasma business, which we have uniquely positioned there. So we are seeing some uptake. Now, that's how our businesses are impacted, reasonably better off than many other competitors, but hit nonetheless. Now, coming to you talking about the ways of work, we traditional companies tend to be very brick and mortar, tend to be very in field, talking to a doctor in the cath lab, in the OR kind of a company. We are having to very quickly reorient ourselves, and I think as a company, we have been on a drive to sort of digitize, modernize, or create remote, capabilities. COVID just brought us forward 10 years or 5 years, So that's a good thing. The good things are that our focus has increased tremendously, right? In a diversified portfolio company, you tend to be a little diffused, but this crisis has really, really sharpened focus. That's one thing. And the second thing is being a company that is dispersed across 160 countries, 28,000 employees, so on and so forth. I think we have seen some tremendous amount of people coming together, this whole feeling of togetherness, of saying that, we are here for a purpose. We are not here just to make a living. We are here for a purpose. We need to be, not just be a medtech company, but be responsible like a medical technology company and do what it takes. So that those are two big wins. To see your colleagues turn into heroes, that's a very big win, I think. And later we will talk about how this may continue in the future. But as I stand, I think those are the impacts that we have, both good and bad.
Great. Thanks, Prabir, and I completely agree. And it's a little unfortunate, I would say, that it took a crisis for us to all come together, to come on these platforms, to change our way of working, to change our way of thinking. And also, I mean, some technologies and modulations which should have been kind of our journey and our lifestyles much earlier. It took a little while for us, but nonetheless, I think we have all reached there the harder way. I
often say man went to moon in 1969. That is more than 50 years back, right? And Eileen today is in the business of remote monitoring, right? When Neil Armstrong was on moon, we were remote monitoring him from Earth. So it took 50 years to come to this point, right? So,
of course.
Yeah, sometimes, a crisis.
Yeah,
crisis
takes thanks, Prabir. And we're all aware that business leaders across Asia Pacific are focusing on navigating the immediate impact of COVID-19 on supply chains, revenue, and profitability, while also reconfiguring capital allocation and M&A, the merger and acquisition plans for the post-crisis world. Okay, move all the discussion further ahead. We can all agree that exiting the viral pandemic will require a well-thought combination of business and communication strategy. At SPAG, we look at it at a phased way of resumption. Phase 1, which is a slow return to BAU. Phase 2, which is introducing prepared communication tactics. And Phase 3, reinventing the corporate image. Mervyn, could you provide insight on what communicative aspects you take special note of when looking at medtech startups and making funding decisions?
Yeah, sure. I think from a perspective of a private equity investor, I mean, we've got the benefit or the bane, I suppose, depending on where you're sitting, of being on both sides of the table. So in the hospital businesses that we own, we are buyers of pharmaceutical and medtech products, and then we also own companies that actually sell those equipment and consumables to these hospitals. So communications obviously is key. It has always been, and I think COVID-19 just brought that to a priority for all companies. I think on the supplier side, when we are selling to hospitals, we think it's important to communicate and reiterate and actually make our customers feel confident that we've got their backs. So, you know, obviously public hospitals have suffered more in terms of ability to pay, but private hospitals as well have not been immune to that. So in terms of communicating to hospitals, I mean, we have offered more flexible terms and explored innovative financing structures with hospitals, understanding their concerns and communicating that, you know, we really want to build a long-term relationship with them and are able to do that because we actually have pretty strong, stable medtech and pharma businesses and are able to actually extend some of that credit over to our customer side. I think on the hospital side, COVID has definitely added significant pressures on our operations. Again, like I mentioned, some of our hospitals are more exposed than others and face greater cash flow pressures. So finding ways to work with suppliers, and I think suppliers who are able to better communicate and support their customers during this period will see an opportunity to gain greater market share, build better, longer relationships that will enable them to emerge stronger after the crisis. And like I mentioned, I think overall the economy will recover at some point, and this is a great opportunity actually for companies, big or small, to strengthen their market position. Another aspect I would add is what we see in the market is I think the guys that are suffering are the smaller local players, and in particular the distributors, local distributors in the markets that we invest in. So, you know, one thing for medtech companies to think about is still channel strategy going forward. We are in close contact with some of the largest healthcare equipment manufacturers, and we do understand that even before COVID, they're thinking of going direct in some of these markets. And I think with COVID, it actually gives them a little bit more to think about going forward. We do not invest in earlier stage companies, and so we are not as familiar or involved in the tech space, but we do think that there is also a big role in digital health and technology when it comes to not just a delivery of healthcare, but actually communications.
Great. Thanks, Marvin. And I believe I couldn't agree enough. And I've been talking to a lot of startup organizations as well. And me, myself, being into the communication side of the industry, I truly believe and understand that there's more value. And I believe COVID-19 has kind of put this thought across to all the people that the communication needs to be more effective, more impactful, and in a more strategic manner than they used to think earlier. Doesn't go, the startups also have to think in the same fashion as well. Moving on to you, Amit, I'm sure you would agree partnerships are extremely important. How have you found partnerships to be crucial during this period of time?
See, Prega, partnerships have always been crucial. It's just that they're moved digital now, okay? But I think there's a collective responsibility, you know, being them in the medtech space, you know, to handle this pandemic. So they play a crucial part. So just to substantiate, I would say, for example, you know, as a community of doctors, we are partnered with the Ministry of Health in Indonesia to train doctors to handle the pandemic. So we have trained around 900 doctors till date. So I think so the partnerships have played a key role in handling this, okay, right, both from a pandemic point of view as a company point of view. So it has been going well. And second part, I think we also have to talk about the HCP patient engagement. You know, that's also kind of partnership, you know, how it has evolved over a period of time, you know, why it is becoming crucial. So, you know, earlier, you know, doctor-patient relationship has evolved to a level of maturity, you know, defined by greater choice, accessibility, and connect. You know, traditionally, it was always with a physical visit between the two, okay? Then some sporadic interactions between the two over WhatsApp till the second visit gets due. But what has Corona done? It has come as a true disruptor. making the earlier mode of predominantly physical interactions unavailable and virtual as the only options. So what has happened is, patients have rapidly transitioned first from resentment, moving to resignation, then experimentation, and then adoption at a surprising pace. What telemedicine was happening for over the last 5 years, I'm sure, my colleagues would agree, it has just happened in 3 months. It has been an exponential growth. So, but I think the technology needs to be given its due when it comes to these kind of partnerships. The devices, of course, are more affordable, definitely. They're more pervasive, more economical. And second is the connectivity, which has played a big part, in establishing HCP patient partnerships, okay, through video or audio. And the interaction is one-to-one or one-to-many, which is a new thing. What are the implications of these changes, on the patient-doctor relationship? I would like to highlight that, with most of the interactions turning digital, the geographical distance has no meaning anymore, which means patients are gonna gravitate towards experts and reputed doctors at the cost of doctors whose main attractiveness was physical proximity. There's no neighborhood doctor anymore. So this will have major implications on doctors in terms of their online reputation management. And that's where, companies like us come into place, So doctors are looking for a niche positioning, super specialization, for example, or continuous self-learning and upgradation to go up among their peers, among their colleagues, So because now they're seeing the patient catchment area, is not local anymore, it's global. Also, what has happened is, with this thing, the doctors are developing their own communication and engagement protocols with patients. Communication has become much more important for them. In fact, I know a few doctors who are building their own digital community, wherein they're engaging with patients one-to-one or one-to-many. And on the patient side, what has also happened is, patients' dialogue within themselves have also seen a push because they're comparing services and prices of doctors, which actually means patient referrals are going to play a much bigger role now, because they're not going to refer a neighborhood doctor. And I think in all of this ecosystem, we have to give the platform its due that enables these seamless, secure, and probably, reliable interactions, which are pivotal for this emergent model of telemedicine, which is coming in, building the HCP patient partnerships. But, I would say there's too much noise that surrounds the communication in the digital world. There's going to be a specter of post-truth, I would say, post-truth conversations, fake identities are happening, practice leaks, pseudo expertise, and fraudulent practices are going well, which would mean, as part of the medtech sector, it would be a premium and natural gravitation towards channels, from doctors or HCPs or patients, that promise authentic and meaningful and trustworthy conversation interactions. So, and once the user's trust is established in this partnership, the challenge is to sustain it at all costs. So as a founder, as a medtech founder, one of the key non-negotiable principles that we have to ensure, to sustain these partnerships is we maintain privacy rights, authentic memberships, and genuine interactions. All else can wait. That's fundamentally has to be strong. That's my piece.
Right. Thanks, Amit. And of course, I agree that partnerships and alliances have always been important, and more so because I'm in the HCP and the patient ecosystem, and their relationships between is very important when it comes to trust, and developing that trust in itself is a big question mark. HCPs have always struggled through this barrier of maintaining or getting that trust from the patients as well. You spoke about patients, the patients going through various stages when it came to adopting the virtual setup and the adoption of all that technology and stuff. I believe HCPs have equally been a little hesitant of adoption of these technologies. So on that front, what's your take on it?
See, the point is, necessity is the mother of all inventions. We've been reading that since school. So I think that answers that. Doctors never felt the need initially, okay? But now that's the only way, okay? Both in terms of course, maintaining their practice. And I think as a responsibility, because you cannot be seeing patients in person, it has to be avoided as much as possible. So I think as I say, this disruption by Corona has played a part, fast forwarded the ecosystem which we were, envisaging probably 2 years, 3 years down the line. It's been fast forwarded to right now. And I think that's here to stay. Being in a doctor's network, having 200,000 doctors, we track the conversations. And we see how the medical associations are actually planning their way out in terms of having telemedicine in place, the guidelines, the ethics are coming in place. So they're serious about it. So they're just not like looking at it as a temporary phase.
Great, great. Sounds like we're entering a better world, a better version of our world that we had created for ourselves.
This is a paradigm shift.
Thanks, Amit. Melissa, Eileen, and Subir, I'd like to know from you, what are the communication strategies you have implemented or are looking out to implement in the near future? And could you share why you think communication can play an important role when we gear up to exit this pandemic? Melissa, let's start with you. Melissa, you want to mute.
Yeah, sorry.
No
so
problem.
when the crisis first hit, we were pretty conscious of the state of mind people were in. There was a lot of anxiety, and understandably so. Confusion, anxiety, uncertainty, right, about what's happening. And so we were conscious of that. And we took that into account when we designed communications. And in fact, we created a campaign called Cure Your Fear, when we realized that things were escalating and people were starting to panic. And we asked ourselves, at the end of the day, what is the reason why we're in business, right? As a healthcare provider, ultimately, we're bringing people peace of mind. And at that point in time, people absolutely needed peace of mind. We needed to help them understand what was going on, and so that they can make better decisions, so that they can make sure they protect themselves and other people from harm, from irrational behavior because of fear. And so we created this campaign, Cure Your Fear, basically as an invitation to anyone at large, a public at large, to engage with a general practitioner anytime they wanted. And in fact, we opened the virtual clinic to anyone around the world because we could, right, as a second opinion. And in Singapore specifically, because of how quickly MOH was able to move, we worked very closely with them to form guidelines, to form a triage where we could help the physical clinics that were really I guess they were handling a huge patient load, and they were overloaded and taxed. So we helped them to triage patients, to help them identify symptoms that are just the common cold versus those that may be at serious risk, right? And in that process, we were able to pick up patients, call up the MOH officers, who then triggered the ambulance and so forth to get all of that done, right? To send patients to the treatment center. So it wasn't just communication in form of words, right? Communication goes beyond that. It's about engaging people in a meaningful way to be able to act in a certain way that's good for them and helpful to them.
Great. Thanks, Melissa. And I must congratulate you for what MyDoc has been doing during this COVID-19 time. I think we all had our eyes on the activities from the organization. Very well done out there. How about you, Eileen? What do you think about the communications as a strategy, and what should be the strategy plan?
Right. For me, let me go straight into how it aligns to HealthBits as a startup for remote monitoring. Given that I always represent innovation, so I'm going to go a little bit radical on this. Essentially, if you look at it, HealthBits is a form of communication too, essentially. We connect our doctors literally to the patient on the ground. Instead of a once every 3 monthly visit, the patient actually, we give them, we provide a medical device to let patients understand their health and communicate directly with their care providers where necessary, whether it's through a chat or call or even just through vital numbers, right, their health data. So what HealthBits has always advocated is really, so if you look at the statistics, right, on average, a patient takes about 3 measurements a day. So in a year, a patient will have 1,000 interactions with the app. And in an event, I have 10,000 patients. Every 10,000 patients, I have 10 million in a year. internal interaction. So it is to us absolutely critical. What are we doing always in every engagement, every interaction? How do we add more and more value to our patients and to our healthcare providers? And that is the most critical part, how we embark on in terms of communication in the past, and as well as moving forward in the future. So in that sense, specifically, I agree with the rest of panelists. All along Medtech is always very heavy on partnership and collaboration type of industry. It's not new to us. So during this COVID, we actually talk a lot to companies whether it is a medical device company, brick and mortar company that would like to use a platform to move closer to the patients or to provide their device in a remote way, or even for insurers who want to reach out, for example, to their customers. So if you ask me moving forward, collaboration partnership is going to be very, very key focus of HealthBiz. We cannot emphasize enough that we want to talk to anyone who can help us to deliver more value to patients than just presenting a number, right? Basically at the end of the day. So that is from a business front. Having said that, as a startup, I just want to point out to one more part of it, and that is internal communication. So so a lot of time, well, I mean, it's very interesting because I just want to relate a simple conversation I had recently with a team member. So the team member asked me, so Eileen, am I going to have my job for the next 1 year? It's as fundamental as that. So my normal immediate response was, I mean, you know, we have projects, you are performing exceptionally. Why are you concerned? Why do you think that that is a concern, right? In that sense. So in response, my team member actually said, because I do not know my pass will be renewed when it's due. So what I'm just alluding to is not about passes. What I'm alluding to is there are a lot of things going on personally within the team. So whether you come from corporate, whether we come from startup, all of us work in teams in one way or another. So it's in the midst of everything, it's so easy to oversight a lot of things that we might not have identified. And at the same time, and it's just the team that put everything together, crisis or not. So the other part that I really would like to really focus on moving forward is to really carefully plan out the messaging internally within the team. Because if you sell a great picture, I don't know, people believe. If you sell a bad picture, people are worried. So it is very, very sensitive nowadays. So the message have to be so carefully planned out, carefully drafted, and how it can be done, can be delivered seamlessly, even though we are a small team. So at the end of the day is how do we input sensitivity and empathy into what we do, what we want to strategize in terms of internal communications.
All right.
Thanks,
Eileen. Very valid point brought out there. And I mean, there could be a complete discussion about the internal comms. And thankfully, I believe organizations have kind of agreed to internal comms being important, because employees are the most important assets when it comes to stakeholders. And this is something which everybody has kind of related to and understand more so than ever before. One of the aspects that we have been talking about. Prabir, could you share about the communication plans for Terumo? And that's in continuation to our conversation.
Yes. See, again, our communication plan goes back to the fundamentals, right? Fundamentals, in a sense, why do we exist? What's our fundamental identity? We are a medical devices company. We contribute to society through healthcare. That's our identity. That's our purpose. Now, when you break that down, to a value proposition, there are two things. Broadly, we are essentially addressing two things. Why would people work here, and why would our customers continue to use our products, right? And when you bring it down to that, and I would, you made a comment about how companies are, you said, thankfully they're looking at internal communication. In my opinion, internal communication is far more important than external communication. Because, you know, if you don't have the right workplace, you are nobody in the marketplace, right? So I think it is very important that we really, you know, as a company, Tirimo really continues to focus on and scale up internal communication. Now, there are two contexts that I wanted to give. You asked about what we are doing in the company, and I wanted to break it down to two things. One, let me say the content of the communication, you know, that dimension. And the other dimension is the framework of the communication. Yeah, because we are such a diversified multi-geography company. It's very important to keep it contextual with content, and it is very important to keep it somewhat uniform, making sure that there's a framework. I would refer to two data points that I recently read, very recently I read. You know, global consumer in the COVID, post-COVID, with COVID environment, they are 62% of global consumers are saying that they want the brands, whether it's an internal brand, I mean, whether you as a brand to your own associates, employees, or as a brand to your customers. 62% of the consumers expect the brand to show a optimistic view of the future. And there, I think the fact that we are a medical technology company makes our job easier. We are not in retail. We are not in luxury. We are not in hospitality. We are in medical technology, and it is a medical crisis. So, you know, I mean, there would never be a day when there would be no heart attack. I hope there is, but unfortunately there won't be. There would never be a day when we would not need a unit of blood for a surgery, right? So fundamentally, it is very important for us. We are focusing on the communication to our associates, telling that Tirimo technologies will always be needed, right? Maybe in different contexts, maybe in different forms, maybe our go-to-market, maybe our business models might change, but the demand of what you are in, or, you know, that's never going to go away. The second thing is 1 in 3 consumers are telling, please don't give us glossy ads. Tell us the truth, right? So in there, I think when we look at our communication strategy, it is on the content part, there are 4 elements fundamentally. One is that we remain very authentic, very truthful. The problems that we are facing, the opportunities that we see, the decisions that we are having to take, whether good or hard, you know, we are absolutely transparent. The second is making it timely and frequent. I mean, today we have our global CEO speaking to all associates once, I mean, all 28,000 associates once a month. I'm trying to speak to as many subsidiaries as I can every week. You know, we have broken down communication to, and I'll come to that when I talk about the framework, but we have broken communication down to little pieces so that we can really create touch points with high frequency. The third element is balancing formal communication with informal communication. You know, some geographies or some types of communication, they need to be pretty organized and formal. But you know, Priyanka, you as a communication specialist will perhaps agree with me more than anybody else that a workplace is not a place where you come for work. A workplace is where you come for, you know, a little pat on the back, you know, maybe even gossip, whatever it is, right? So we need to continue to maintain that collegiality in our communication. So, so that's something that we are trying to do quite aggressively. And lastly, on that dimension, we are talking about having communication at all levels, right? This is a time when culture, company culture, is the most important thing, right? And culture is not owned by the CEO. Culture is actually owned by the middle managers, you know, because they are the connect between the strategic and the on ground. So I think, you know, we are trying to see how we can increase both communication absorption and communication push out at the middle manager level. Now, coming on the framework part, we have quickly pivoted our communication framework to 4 areas. 1 is commercial, 2 is efficiency, 3 is talent, 4 is culture, right? So we have created this, communication on commercial authenticity, how we are doing, what we are trying to do. Efficiency is very important because unlike a services enterprise, we make products, right? Even if there is a high demand, we'll have to make a plant first to cater to that high demand. It's way too complex than scaling up your app, right? So it is a brick and mortar company, so all of that. And then talent and culture, fundamentally, very, very important. Now, moving forward, we are also really going down to an individual associate level and asking them much more frequently, how are you doing and what do you think we need to do to support you, right? So that kind of communication, it is not easy when you have 30,000 associates throughout the world, but I think, we are getting much better at this than we used to be, much better.
Thanks, Prabir. Absolutely wonderful to hear your thoughts. What a fantastic discussion. I've heard from the leaders in the Medtech scene on what the most important aspects of communication are when exiting a pandemic. Now, let's look at, I mean, there are a lot of questions that I see, some very fabulous ones, but I think the discussion was just very interesting to sort of stop somewhere. I'll take one question, which I think is the most relevant, and which is the first question. A crisis should never be wasted. One positive outcome of the current pandemic is creation of a handful of really big winners, some of which are already evident in how big tech and big pharma stands to benefit. How should such corporates communicate if they are disproportionately profiting, even while the global economy in aggregate is suffering through recession, bankruptcy, unemployment, etc.? Who would like to take, Prabir?
Yeah, I think, that question was directed at big pharma or big medtech, perhaps at $6.5 billion, I must answer, right? So, see, there is a difference between profit and profiteering, right? And if somebody is utilizing COVID to profiteer, right, unevenly, that would be very unfortunate. And I'm a one-trick monkey. I've only worked for medical technology for the last 30 years for several global biggies. I wouldn't think that today is a big problem. Yeah. That said, it is very important to be very transparent, and quite frankly speaking, for large medical technology companies or perhaps even large pharma, I'm not speaking on behalf of pharma because I don't represent pharma, but I know truly of medical technology. The larger you are, the larger are your fixed cost base, right? And in a COVID-like situation where many of us are impacted from anything between 20-30% to 70-80%, it's a huge challenge. It's a cash flow challenge, number one. Profitability, I mean, quite frankly speaking, we are not even looking at profitability right now. We are looking at just bringing enough cash to tide through this, right? So it's no longer a profit. I don't think profiteering is an issue. But if that was the case somewhere, I think there is enough regulators, and quite frankly, there is the marketplace. I speak for myself. We are a 100-year-old company, and the society does not let you be in the marketplace for 100 years if you have done things wrongly, right? So it's quite a test of time. I mean, if we did profiteer, or whosoever will profiteer using COVID will not see the next 100 years. And we definitely intend to be in the market for a long time to come.
Thanks, Prabir, for your insights over there. I believe there will be one poll that will be run up, and any questions and concerns that we have not been able to answer over the discussion just now, you can, of course, drop in a mail and we'll be happy to discuss that further. That concludes our Q&A session. Thank you for the wonderful questions. Many thanks to the speakers, Mervyn, Amit, Melissa, Eileen, and Prabir for your time on this session. Thank you so much, everyone, for attending this webinar. Businesses need to remain agile and prepare for future crises, and we hope we have provided useful insights to our audience today. My name is Priyanka Bajpayee, and reach out to SPAG if you have any questions about communication strategy in these testing times and ahead.
Thank you, everyone. On behalf of APAC-Med, thank you to the panelists. It was a great audience and great interactions, very lively. Thank you so much. Have a great day, everyone.
Thanks, Marilyn. Thank you. Bye-bye.
Bye.